So staff have asked us, how safe am I to work in a patient-facing or client-facing service whilst being pregnant? And our advice is very much shaped on guidance from Public Health England, Public Health Agency and the Department of Health. With regards every pregnant employee or staff member, we are requesting that their line managers undertake a risk assessment, and provided they have no underlying health condition, they should be safe to work. In addition to that, we are asking that managers try and allocate work that is not patient-facing or not COVID patient-facing, and also that may involve working remotely or undertaking admin duties away from the department. For those staff who are 28 weeks pregnant or more, however, we're asking for a more serious approach in terms of ensuring that staff are undertaking admin work away from the office, and preferably at home if that is possible. We've had a number of queries from pregnant staff who are concerned that they are undertaking duties that they've not normally been engaged in undertaking, such as admin. So those staff, AHPs or nursing staff who've been asked to undertake admin duties, the reason for this primarily is to safeguard you during your pregnancy and ensure that you're not in a patient-facing or a COVID patient-facing role. So where possible, we're asking managers, in addition to the risk assessments, that we try to identify and allocate work of particularly an admin nature that will enable you to continue working but not be in patient-facing areas. A number of pregnant staff have approached us asking for home working because they're pregnant. And in the first instance, we are always ensuring that they've had those conversations with their line manager, that a risk assessment has been undertaken, they don't have any underlying health reasons, and that all avenues can be explored, including home working. Remote or home working is not the only opportunity open to staff who are pregnant at this time. If you're undertaking admin duties under 28 weeks pregnant, this can continue. If you're not patient-facing and you're not COVID patient-facing, this will be safe. We are exploring all avenues possible, including home working, and where this is appropriate and available, your line manager will put that in place for you.
We don't want any women to have any concerns. We want you to be able to share those concerns with us. We want to be able to reassure you. So there are lots of different ways of achieving this. You can contact your own community midwife or the midwife in the antenatal clinic, or you can contact the admissions department in Royal Jubilee. But as well as this, we realise that these are very difficult times and concerning times for pregnant women. And so therefore within Royal Jubilee Maternity Service, we now have a dedicated helpline. It's a telephone line that women and their families can make contact, and they will then get to speak directly to a midwife. Alongside the telephone line, we also have a dedicated email address, and again we welcome your questions and your queries, and we will be able to give you advice and support or signpost you to somebody that can. We also have the Belfast Trust maternity website, which you can access for all sorts of information on antenatal care, early pregnancy care, parenting and birth options. The Public Health Agency has also recently launched a Northern Ireland maternity and parenting webpage, and this will also give you lots of different information about antenatal care, labour and birth and postnatal care. And there is also the provision of virtual antenatal classes. Each of the trusts are featured on this website. And again, you can get specific information on Belfast Trust maternity services. So always make sure to make contact with a midwife, and she'll be able to answer your queries or concerns.
The health and well-being of our women, babies, staff and wider community is our priority. You should be advised to attend your antenatal appointments alone. However, your companion can await outside the building or in the car should you require support. Within the birthing environment within Royal Jubilee Maternity Services, partners are welcome to attend with you. This can be for normal births, Elective or emergency caesarean sections, your partner will be included throughout the journey. Should you require to be discharged home from the labour ward environment, your partner can remain with you and be discharged with you as a family. Should you require admission to the postnatal ward, your partner will be asked to go home. There is currently no visiting within antenatal areas, postnatal wards, unless in exceptional circumstances that have been pre-arranged by the midwife in charge.
Okay, despite having to reorganise our services, we want to reassure all of our women that we are continuing to promote and support midwifery-led care, both antenatally and during the birth. So within Royal Jubilee, we have dedicated rooms for midwife-led care, so women will experience the same birthing environment as they would have in our previous midwifery-led units. So the rooms are quiet, the lighting is dimmed, and there's lovely relaxing music. We still continue to provide all the birthing aids to support upright birth. So birthing balls, birthing mats, and our comfortable upright birthing support stools. So we do want to reassure women that midwifery-led care is still being supported within Royal Jubilee Maternity Service. Some of you have been asking about water birth, and we want to again reassure you that we are very supportive of water birth for those women who are non-COVID. We also continue to support women who are opting for home birth within our service. So within the North, West and South Belfast areas, our community midwives continue to support home births.